AFA today on AFR Talk. Kevin McCullough, so glad to have you with us. Coming up on the broadcast, we hope Lieutenant General Jerry Boykin joining us to discuss what should have been the number one headline across America today. The fact that it wasn't is a scandal. And also, in just a moment, we will discuss some new headlines related to the truth about the Affordable Care Act that's not being told either. Anyway, before we get to that, the American military is equipped with the finest weapons in the world. However, thousands of our soldiers worldwide are still waiting for a crucial piece of spiritual equipment, a Bible that can go anywhere. Hence, the military Bible stick, developed by Faith Comes by Hearing and approved by the Department of Defense. The lightweight audio device contains a dramatized version of the New Testament and selected Psalms. They've made 400,000 of these units and sent them to chaplains all over the world. And when support is sent to provide a military Bible stick, not only are they going to send the Bible stick to the troop, they are also going to send the same content on a CD version or MP3 to the spouse and the children of that military serviceman or woman as well. Chaplains are requesting these audio Bibles for their soldiers, sailors, airmen, and Marines, and when the requests come in, the Faith Comes by Hearing wants to be able to respond right away. They cost $25 to underwrite the cost of one Bible stick. Would you call right now? Thus far, I believe we've supplied a little over 400 of these just in the last couple of days. 800-800-2555 is the number. 800-800-2555. You can also visit militarybiblestick.com. That's 800-800-2555. 800-800-2555. Now, earlier this morning, Fred Jackson of the American Family News operation, onenewsnow.com, sent me this headline, Consumers Losing Doctors with New Insurance Plans. I knew that I don't have the credentials to be able to deal with this, but Jake Veely is someone that has studied Obamacare since before it was passed and was sounding the alarms long before I ever came along. You may hear him on the Steve Deace Show and other national platforms. But he was able to sit down with me a little bit earlier this morning to discuss this very headline and to fill us in on what it means that consumers are actually losing doctors through the public exchanges. Here's some of how that went. Family News and some other folks sent it my way. But the first thing that people are noticing in some of the exchanges and so forth is that consumers are losing the doctors with the plans that come along. And this is one of those things that some people that were paying attention to what was going on with the new health care law were predicting was going to happen quite some time ago. And I am glad to welcome back to the broadcast Jake Veely of National Integrative Health because he is, in fact, one of those voices that tried to say on a regular basis, hey, let's be careful here. Let's not throw the baby out with the bathwater. And, Jake, it's good to have you back. Unfortunately, nobody listened.
Well, I think maybe some people listened, but a lot of people just chose to kind of put their head in the sand and hope that everything was going to be okay.
Our lawmakers didn't listen, that's for sure.
That is true. They did not.
They didn't even bother reading, evidently. So what does this mean? The Associated Press puts this story out today. What does it indicate?
Well, it's a story that has started to unfold here from the very, very beginning when we first saw these new health insurance plans that were on the public exchange, these marketplace plans. And what we warned people was when we saw the design of the health insurance plan on these various different exchanges across the United States, what we were seeing was the insurance companies were hedging their risk by doing what was called network narrowing. And what that means is they were trying to keep the premium levels down to make the plans look like they were affordable. And on the back end, the way that they were able to keep their premiums somewhat low, even though people across the country experienced, on average, 35% rate increases, what was happening was the insurance companies, to lower their own risk, were narrowing the networks, or they were getting rid of a lot of the coverage for physicians that weren't in their lowest reimbursement tiers, meaning they got the insurance, they got the higher reimbursement from the insurance. So they said, well, those doctors, we pay more. We're gonna not have them covered in this specific public exchange plan. We'll have them in our other private plans, but in this public exchange or this marketplace plan that we're putting out there for the general public, that plan, we're going to narrow that network down and cover only 50%, for example, of our specialist population or of our primary care population. So this network narrowing was something that we started talking about over 8 months ago. And actually, when the plans were filed mid-year last year, it was very evident right away that the coverage was not the same as what people were used to.
And that's one of the real tragedies here, Jake Veely. People have been promised so much, and yet they've had so little delivered. In fact, I have talked with more and more business owners. They are completely priced out of, even in just the private market, private entrepreneurial business owners being priced out of being able to even offer health insurance for some of their employees, and some of them seeing 300 to 600% increases in the cost of just even keeping any kind of coverage in their company over the last 3 years. But in addition to that, the quality of the coverage has gone down, down, down. A specific example, small businessman I know runs a title company, about 15, 20 employees. Gold plan 3 years ago, X number of dollars. Following year, had to go to the middle level plan, same number of dollars. Third year, had to go to catastrophic plan, and the price went up. This is not good for the average worker. It's not good for the average small businessman. And part of it, and part of what you guys at National Integrative Health have put your finger on, is that part of the problem is that we're thinking about how we do our health care in kind of a backwards way from really what the market could allow it to be and make it more cost effective. What do you mean by that?
Well, I think if we look at the real issue here, people are concerned about health care. In health insurance is just a middleman, so to speak. It's just a vehicle that helps us get to health care, that is the end result. I think a lot of people would understand the concept of if we don't have a good healthcare system that is there ready to accept us when we get there, it really doesn't matter what vehicle we use to make the journey. And unfortunately, all the reform efforts were around health insurance, and the specific ways that this law was adjusted made it absolutely impossible for health insurance, the primary vehicle that most of our families in this country utilize to get to health care. It made it impossible for health insurance to become more affordable, which is why it was almost ironic and laughable that the word affordable was even used in this bill, because it made absolutely nothing more affordable. So our primary focus now, what we've done at National Integrative Health, what we're doing with our corporate clients and enterprise clients across the country, as well as the healthcare clients that we work with, is we're helping people change the way that they build their family healthcare strategy. And that strategy is two-pronged. It's, excuse me, how do I get my health insurance, this vehicle that I've normally depended on to make sure that I was safe and secure? And then what type of health care does my family have access to? Because one thing that I can guarantee everyone who's hearing this, you will not have the same coverage that you have today for the same amount of money that you're paying today next year, for sure 2 years, and absolutely no way is it going to be 3 years from now the same.
Yeah.
So the question that a lot of families have had to ask themselves, and employers who utilize health insurance as a benefit to attract a strong workforce, people have had to start looking at, okay, if I'm not going to have the same access to coverage for the same cost, I know it's going to be going up. And we're talking increases over 100% in the next 3 years. No one has all that extra money. Well, I shouldn't say no one. Maybe there's a 1% of the population who has plenty of extra money to pay for whatever increases may come. But most of us just simply don't have a buffer of 100% to increase in our health insurance access. So we have to say, is health insurance really the only way that I can get to the healthcare system? The answer is no. So at National Integrative Health, we've built a new way of delivering healthcare services across the United States where people do not need their health insurance plan to utilize our virtual family clinic services. It's just a simple monthly membership. And there is incredible innovation coming across the entire healthcare industry. This is what the United States enterprise system is all about, even though there's a lot of gloom and doom, and it's not just pandering. This is real. This is actually happening. The stuff is not good. But there's a lot of really positive things coming too.
He's one of the most authoritative voices on Obamacare in the country, and he's also a brother in Christ, and so we're fortunate to have him as a resource here. Kevin McCullough speaking with Jake Veely of National Integrative Health. If you want more information on what he was just discussing, you can go to virtualfamilyclinic.us. That's all one word, but it is what it says it is. It's a virtual family clinic. It's an online medical clinic program that helps exactly what he was describing, kind of a free market approach to accessing actual health care, not necessarily a health insurance replacement, but an access to health care. And Jake, I want to ask you about this. The Heritage Foundation recently put out a white paper in which they kind of identified 9 predictions that had been made about the Affordable Care Act that have come true, and a couple of them really stand out to you. What are those?
Well, I think one of them that a lot of people aren't going to say, well, that's a huge surprise. But one of them that, and again, these are things that have proven to come true. They were predictions. They have come true. Number 5 on this list was the law guarantees major premium increases, which is what we were just talking about. The average cost for a family to have health insurance coverage is going to jump and climb faster in the next 3 years than it ever has in history. And that's not just because the plans are getting more expensive, so to speak. It's because employers are no longer able to shoulder as much of that financial burden.
Right.
They have to try to keep their companies going. Their number one concern is to be able to cover our salaries. And when healthcare becomes so expensive, they can't share in the lion's share of the cost anymore. They have to start tailoring back. And what happens 9.5 out of 10 times when companies are doing this is they also are changing plan design, which means deductibles are going up, out-of-pocket expenses are going up. What we call those first dollar healthcare expenses within the health insurance policies that we carry are going up. Those things that we used to be accustomed to having them pick up right away and start paying for healthcare services right away, and that just won't be the case. We're going to start seeing a lot more high deductible health plans. We're going to see narrower networks, so there's going to be less coverage. We're going back to the olden days when, in the HMO days where there were really much more narrow coverages versus what is known now as the PPO plans, which are the preferred provider organizations. Those are the really broad plans that cover almost any doctor in your area. We are going to see a complete shift in that. So, meaning
that it's going to go back to the narrower HMO model.
That's correct.
And not only that, we're seeing the statistics in the news stories almost every day of doctors leaving the business. So what I'm thinking, Jake, here is not only are the plans themselves narrower, the free market is narrowing from the standpoint of even getting access. Like, I think your wait time in the waiting room is going to double and quadruple and so forth over time, because there's just going to be fewer doctors to actually. Whereas if they took advantage of some technology, like face-to-face video, meetings and telephone consultations and other things. And these technologies have been around, and I believe that your services even provide some of those things. But guaranteeing access to a doctor in a short order and to get a thorough discussion with him. The lovely bride, our 2 ankle biters, they got to go in every, a few weeks, just for their general wellness stuff. And I don't want my healthy boys sitting in a sick waiting room with all the other kids. And because there's fewer doctors, that wait becomes longer. That exposure becomes more imperative. It seems to me that technology has to be applied to healthcare services if America is going to survive this.
Well, what you're going to see is the doctors, the brightest minds in medicine, are going to start taking control of a system they largely have not had any control over the past decade or two, and they are going to start providing all of our families with what we are going to see as new ways to access their services, which is why I wanted to make very clear in the beginning of this conversation was these are two separate conversations. We're talking about health care on one side of the table, and the other side is health insurance. They are not the same thing, and we are really concerned if we boil it down to the very basis of this argument. Talk about the Maslow's hierarchy of needs, so to speak. What we're really concerned about is being able to have access to good care, not necessarily the insurance itself.
Right.
And you will see the brightest minds in medicine starting to take control of that. It already is happening. It's one of the things that foundationalizes what we're doing at the Virtual Family Clinic at National Integrative Health, and what we have colleagues and partners doing all across the country is giving families a new way to access great care, longer opportunities to speak with a physician, which is one of the things that's being squeezed right now big time, is average time in front of a physician is down to 5 minutes in an office visit. And, when you're only spending a couple 5-minute sessions in front of a physician every year, it's really hard for anyone to argue that that's going to meet the needs and the goals that you have for the health of your family.
Yeah, I understand that. Jake Veely, thank you for being with us. Kevin McCullough, AFA Today. If you want more information about any of Jake's work, it's really very well done. Virtualfamilyclinic.us. Coming back with Lieutenant General Jerry Boykin. Don't go away.